It's been life-changing. I decided I was going to take a new career and went into occupational therapy. But what a great experience, an unbelievable experience. I would recommend it to anyone that has a desire to work with people, to actually help people. There's so many areas in occupational therapy. There's pediatrics, there's adults, there's skilled nursing facilities, there's rehab, there are work ergonomics, and it's hard to imagine that in a 18-month, 2-year program that you can get enough experience in each of the areas. When you talk about all of the different areas that OT works, the education that we received was foundational. It was all just foundational for each of these different areas. The courses that I took truly prepared me to go out there, but I learn so much every day when I'm right there working with the patients. Oh, lots of hands-on, lots of hands-on. Absolutely, we're in the anatomy lab. We're working with cadavers and looking at muscles and joints and bones, and we don't go as detailed as the DO program does, but we're right in there. We had splinting labs, we had peds labs, all sorts of labs, always hands-on. We also had opportunities to go out into the community. They set up community-based learning opportunities for us. The medical experience you need in the medical background is pretty intense as well. They have an interdisciplinary course that they taught here on campus as well, and we all meet in the lecture hall, and you're in there with the PA students and the DO students and all of the different disciplines in this interdisciplinary program, which was really good. When you're out there working, that's how you work. I mean, everybody's involved in patient care. I have some wonderful mentors right now who are physical therapists and speech therapists that are absolutely amazing. I learn every day from these people, every day. Oh, you know, it's an amazing amount of support you have here. When you come on campus and you start the program, from the minute you start signing your paperwork and saying that you're interested in the program, there's an amazing group of faculty. They're kind and helpful and supportive. They take a personal interest in each one of the students. We have 2 level 1 fieldworks, where you're actually hands-on 40 hours each one of those clinical rotations, and both of those should be in different settings. And then you go into 2 12-week rotations towards the end, at the very end, and each of those need to be very different as well, so that you have the opportunities to explore all the different areas of occupational therapy. They do through the university have different programs, Spanish Club and different clubs. We in our own department, Occupational Therapy, had our Student Occupational Therapy Association. It was a group of students that would do fundraisers and earn money to be able to go to our national conference. And it started from the first quarter. There were a lot of opportunities for volunteer work with disabled individuals, both in pediatrics and in adults settings. What a great opportunity to be able to be there and see it and have to experience it right there firsthand. You hear about it, but to actually be able to experience it. I also had the opportunity to go to Guatemala on the medical missions with the DO students and PA students. I was the first OT student to be invited to go to Guatemala and help on the medical mission, which is, you can't even imagine what an experience it was for me. So I actually did it 2 years. I did it my first year and my second year as a student here. Lots of opportunities. I mean, the sky's the limit. All I can say is it's an amazing, amazing program. The amount of support you have, and everybody's on the same boat. We're all here struggling to get through and get out there, but this is the place to be.